Hi friends, this video is going to be on Ascard Plus tablets. Ascard Plus tablets contain acetyl salicylic acid, which is aspirin, and clopidogrel bisulfate. The box has 10 tablets in it. It's made by Atco Laboratories Limited, and the price for one box is 169 rupees. Clopidogrel is used alone or with aspirin to prevent serious or life-threatening problems with the heart and blood vessels in people who have had a stroke, heart attack, or severe chest pain. This includes people who have percutaneous coronary intervention (PCI) angioplasty, a type of heart surgery that may involve inserting coronary stents, metal tubes surgically placed in clogged blood vessels to improve blood flow, or who have coronary artery bypass grafting (CABC), a type of heart surgery. Clopidogrel is also used to prevent serious or life-threatening problems with the heart and blood vessels in people who have peripheral arterial disease, poor circulation in the blood vessels that supply blood to the legs. Clopidogrel is in a class of medications called antiplatelet medications. It works by preventing platelets, a type of blood cell, from collecting and forming clots that may cause a heart attack or stroke. Clopidogrel comes as a tablet to be taken by mouth. It is usually taken once a day with or without food. Take clopidogrel at around the same time every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take clopidogrel exactly as directed. Do not take more or less of it, or take it more often than prescribed by your doctor. Clopidogrel is also sometimes used to prevent blood clots in people with atrial fibrillation, a condition in which the heart beats irregularly. Talk to your doctor about the possible risks of using this medication for your condition. Some side effects of clopidogrel include excessive tiredness, headache, dizziness, nausea, vomiting, stomach pain, diarrhea, and nosebleed. If you have other serious side effects such as itching, difficulty breathing, swelling of face, black or tarry stools, red blood in stools, bloody vomit, etc., you should consult with your doctor. This medication also contains aspirin. Aspirin therapy is very helpful for people with coronary artery disease or a history of stroke. If you have been diagnosed with CAD, your healthcare provider may recommend that you take a daily dose of 75 to 162 milligrams of aspirin. A daily dose of 81 milligrams is recommended for people who have had a PCI angioplasty. It is most often prescribed with another antiplatelet medicine, which is clopidogrel. Aspirin can reduce the risk of heart attack and ischemic stroke. However, using aspirin over the long term can raise your risk for stomach bleeding. Taking aspirin helps prevent blood clots from forming in your arteries and may help lower your risk for a stroke or a heart attack. Aspirin helps get more blood flowing to your legs. It can treat a heart attack and prevent blood clots when you have an abnormal heartbeat. You probably will take aspirin after you have treatment for clogged arteries. Some side effects of aspirin include diarrhea, itching, nausea, skin rash, and stomach pain. Call your doctor if you have any other serious side effects such as nosebleed, unusual bruising, heavy bleeding from cuts, black tarry stools, or you are coughing up blood. I hope you like the video. Please like and share our channel, subscribe to our channel. Thank you.